Hi everybody, this is Dr. Eric Bricker, and here I am again at a Frontier Direct Care clinic. As you can see, now I want to talk with you today about serious things that happen at all primary care practices, and that is a patient comes in, and it could be for an unscheduled visit or sometimes even for a scheduled visit, and they're actually much sicker than they thought they were. They actually are having a medical emergency that they didn't realize they were having. And so one of the common situations for that would be like chest pain. Okay, so somebody comes in and they're like, oh yeah, I'm a 54-year-old male, and maybe I'm overweight, and maybe I got diabetes, and maybe I'm a smoker, and maybe I even had a previous heart attack, and oh, by the way, I'm having chest pain now. And that chest pain that I'm having, it's kind of like my previous heart attack. Okay, so that's a medical emergency. So we're not gonna be able to treat your potential heart attack right here in the primary care clinic. Literally, primary care clinics across America all the time, they call 911, and then the ambulance has to come to the primary care clinic. But there are things that we can do at the primary care clinic that are super helpful. And I'm gonna show you this little bottle. And this little bottle here, maybe you can see it, it says nitroglycerin. So we can actually give people nitroglycerin tabs here in the clinic, and you stick it underneath your tongue and it dissolves, and it almost immediately decreases the pumping stress on a person's heart when they're having a heart attack or a potential heart attack. So it's super helpful. So literally, if you were to walk into an ER with those same sorts of symptoms, they'd give you nitroglycerin. So some of the things that would even happen in an ER, you can do here in the primary care clinic. So of course, if you're coming in and you have a true medical emergency, it's super helpful because then the clinician can actually identify that, do things to help stabilize you, and activate 911 to actually get you to the ER. So just know that sometimes patients don't even realize they're having an emergency, but the primary clinician does, and we're able to help them and get them where they need to be. Thanks so much for watching.